Hi, I'm Dr. Corey Rice, internal medicine physician and BioTE Medical Advisory Board member. I'm here today to talk to you about male testosterone replacement therapy with pellets. Why pellet therapy is so superior is because of the absorption of this therapy. When you implant this underneath the skin, you get a constant delivery of testosterone over time, and it's really dependent on your activity level or your cardiac output. So when you're active, you're intimate, or you're working out, or whatever you're doing, you're actually using those pellets. But when you're dormant, the pellets are dormant. It's exactly what happened when we were naturally producing hormones when we were younger. Symptoms that men report to me in my practice are things like fatigue, things like joint pains, low libido, potentially loss of firmness in erections, or just not sleeping well. Men consistently report that they're not seeing the results in the gym. They put the work in, they're not seeing the results out. This therapy, when you get your levels where they need to be, absolutely produces the results if you stay with it over time. Your BioTE certified practitioner has been trained on you as a biologically unique individual and how to dose you correctly. That's the key to this therapy. If we dose it correctly based on you, your weight, your age, your blood work, your objective parameters, you typically get maximal results, while at the same time looking at things like thyroid, vitamin D3, iodine status, how do you eat, how do you not eat, how do you exercise. You do all of this right, your therapy will work tremendously well. A very important part of testosterone replacement therapy is that your practitioner is following your estrogen level as a man. Men have estrogen, men need estrogen, but you just don't want it to be too high. DIM, as provided by your BioTE practitioner, helps to balance your estrogen healthily and helps keep that testosterone-estrogen ratio optimized. After you get your pellet therapy done, you'll typically start feeling it within 2 to 3 weeks. The peak absorption of this is about 4 to 5 weeks. So when you feel at 3 to 4 weeks, the way you feel there is how you should expect to feel for the next 4, 5, 6 months, depending on your activity level. Another common question I get is why is my testosterone low? I'm only 28, I'm 38, I'm 48. What's the deal? Why are we low? And that's a very loaded question, but I can tell you in general, things that I've noticed, lots of stress, our environment, right? Living in a very toxic environment, not eating well. Physiologically, at the age of 30, men start losing 1 to 3% annually. So it's hard to necessarily fight aging, but you can certainly healthily age. So we're just trying to support you and get you back to where you're optimized, while at the same time providing you the medical protection we should as physicians. The way the procedure works is we just clean off the area where we're going right here in your hip, and then we put some numbing medicine under the skin, and then one by one your doctor will start placing the pellets underneath the skin in the right area. After that, they put a bandage on there. 7 days later, you pull off your bandage and life is good. The things you cannot do for the next 7 days, very important. You cannot exercise your bottom for any reason, right? So you can't do any glute activities, no stair stepper, running, cycling, anything like that. What you can do is a brisk walk. You can do upper body if you have to, things like this, but nothing, you need to protect your investment. So nothing that requires any glute activities. The other thing you can't do is you can't submerge it in water. So no hot tubs, no pools, no baths. You can shower all you want. You can shower the night of the procedure. Just don't submerge it because, again, there's no suture there. We don't want to have any issues with infection. So thanks for choosing BioTE. We're very excited to have you. Welcome to your new life.